I hope he does.
Like after we graduate?
Yeah.
That would be wild.
So this is part 2 of upper limb trigger points.
Let him know he still has to do that report.
That report in front of the dean is still happening.
By himself.
So let's talk about
I did mine by
some
myself.
upper arm trigger points. We did shoulder last week. So we have the supraspinatus. Oh, possible causes. Carrying heavy objects that pull inferiorly, such as a suitcase. This is fun. I like this one. Walking a big dog that pulls hard on the leash. Lifting heavy object above shoulder height. So, lifting trauma, right? Symptoms or indications: pain during shoulder abduction. Severe sleep disturbing pain, which is actually a big indicator for rotator cuff issues, by the way. Want to know why? Because this is a rotator cuff. Stiffness of the shoulder, or maybe a snapping or clicking sound at the shoulder when moving it. Right? Pain patterns. Top of the shoulder. Lateral arm down to the wrist. Other trigger points associated with this would be your infraspinatus, trapezius, and deltoid. Differential diagnoses: cervical arthritis, spurs, bone spurs with nerve root irritation, brachial plexus injuries, subacromial or subdeltoid bursitis, or rotator cuff tear. Infraspinatus causes acute stress or multiple overload stress. Reaching arm behind and away. Right? This is fun. Twisting arm during a fall. So trauma and overuse is what it just should always say. Symptoms would be pain when brushing your teeth or combing your hair. So any movement like this, right? We're lifting away. Inability to medially rotate and or adduct shoulder simultaneously. Inability to sleep on the painful side. So we're adducting and medially, so it's going like this. Pain patterns most intense in the shoulder. It's going to go down that lateral arm or forearm and sometimes into the hand a bit. Most of the trigger point pain is going to be right where the muscle is. Associated trigger points would be teres minor, anterior delt, supraspinatus, and biceps brachii. All right. Differential diagnoses would be nerve entrapment in the subscap, bicipital tendinitis, so tendinitis of the bicep tendon, scapulohumeral dysfunction, or glenohumeral joint arthritis. So if you're not feeling trigger points, things are getting better with massage, refer out. Teres minor. Ooh. Causes, possible causes: reaching behind the shoulder in extension, a motor vehicle accident, reaching overhead, such as playing volleyball. Indications or symptoms: posterior shoulder pain. Pain patterns: posterior shoulder, down the arm a little bit. Other associated trigger points: infraspinatus. Other diagnoses: compression of the axillary nerve in the armpit, subacromial or subdeltoid bursitis, ulnar neuropathy, or acromioclavicular joint separation. Ouch. Now we have the guy underneath the scap, your subscap. This could be caused from repeated forceful medial rotation, such as swimming or throwing a ball, right? Pitching. Repeated overhead lifting. Dislocation of the GH joint. Prolonged immobilization of the shoulder. So you can get trigger points if you're in a sling for too long. Pain symptoms. Pain when arm is at rest and in motion. There's no relief. Restriction when abducting the shoulder or the inability to reach across to the opposite side. So that is also why when you're doing shoulder work and moving the arm around, make sure people don't have pain when you do reposition their arm. Because I know I do a move where I cross the arm, but some people can't do that. So you're just going to have to get creative. Where am I at? Pain patterns. Posterior shoulder radiates over that whole scap, goes into the posterior arm, and kind of skips down to the wrist. Which I think that's crazy because you might think you're having like carpal tunnel symptoms, and it's actually a trigger point in your subscapularis. Other trigger points: pec major, teres major, bless you, lats, long head of the triceps. They might also have a rotator cuff tear, frozen shoulder, so adhesive capsulitis, or thoracic outlet syndrome. We're getting it. Now we got your biceps. This is a quick lecture. Yeah, we got 3 slides left. Biceps brachii. Causes: elevation of the arm above shoulder level. Overstress during activities such as strong tennis backhand. Wow. Hold on. I lost my screen. What a strong tennis backhand you have, sir. Hold on. Where's my screen? I don't know why it does this sometimes, because I am touching my computer. It is just not working.
Oh, darn.
There it is. We are not done. Biceps brachii. Where was I at? Oh, yeah. Strong tennis backhand. Lifting a heavy object with the palm of your hand facing upward. So box, right? Repeated supination. I did not notice that I have been in severe Zoom here. And y'all did not tell me. Severe Zoom.
Could read it.
Oh, I can shift this. Oh, hold on. Okay, every time I get past this section, it does not want to. Now that the whole internet knows that this one here's got flatulence.
Are we still recording?
We are recording. With Kiki discussing her movements. Okay, this thing is not working. I'm trying to like... Y'all can't see in this recording, but I'm trying to get the picture centered on my... There we go. Is there an OK button? Escape. Escape. All right. Symptoms for bicep brachii. Trigger points. Superficial anterior shoulder pain. Tenderness over the bicipital tendon. Weakness, raising your hand above your head. Pain patterns, anterior shoulder, down to the anterior surface of the elbow. So it's really covering the whole biceps area. You could also have a trigger point in the brachialis, your supinator muscle, or your triceps brachii. You could also have bicipital tendonitis or bursitis of the subdeltoid or subacromial region, glenohumeral joint arthritis, all that good stuff. So here's the triceps. Causes excessive city driving with manual transmission. Don't do it, guys. You can do it in the country, just not in the city. I'm kidding. Over-enthusiastic exercise, so overexertion, right? Needle point without elbow support.
Oh my
Are we talking about
God. Yeah.
not crocheting,
Needle point. Yeah.
knitting? We're talking
Needle point.
like
needle.
the
point
where you stick it in the little fabric canvas.
Like a felt. The little ring with fabric.
Have you guys ever done felting? Like made a little creature? That's fun. Yeah, me too. Like 20 times, then cuss. All right, it hurts. Yeah. Well, don't needle point unless you have proper elbow support, please. All right. Symptoms: difficult to locate pain in the posterior shoulder, inability to fully extend your elbow. Pain patterns: posterior shoulder, posterior arm and forearm down to the pinky and the ring finger. Fun. All right, so we're continued. Associated trigger points. Uh-oh, nice save. Lats. Teres minor, teres major. Other diagnoses. Entrapment of the radial nerve. Remember, that's confusing because usually the ulnar nerve is these two fingers. I'm questioning it. Entrapment of the radial nerve, it says. Tennis elbow and lateral and medial epicondylitis. Typically, if it's ulnar nerve, you're feeling it in the pinky side. Typically, if it's radial, you're feeling on the thumb side, but I feel like it's wrong.
How are the lats associated with triceps?
That's just where you can have pain patterns.
They're not connected, right?
No. So the lats will kind of come up like this.
On the spine and intercostals, right?
Yeah. Okay. But it comes up pretty high.
Okay.
So that's where you might have pain patterns
Okay.
that might tell you it's somewhere else, right?
That just seems like a stretch for me.
It's a stretch. All right, we'll continue part 3 next week. 5 minutes. That was a 5-minute PowerPoint presentation. No.